everyone, welcome to the Social Doctor. And this is Dr. Ayushi. The Social Doctor is a platform for the doctors by the doctors, where we discuss the experiences and knowledge from successful medical practitioners. And today we have Dr. Manish Saxena with us. With him, we are going to discuss the opportunities and fellowships in the branch of pediatrics. He's currently working in FMRI GURGAON as a consultant pediatric cardiologist. Welcome, doctor, to our platform, The Social Doctor.
Yeah, hi, thank you.
So,
thank you for having me.
Yes. No, we are also very happy to have you here. So, as I know that you have pursued your MD in pediatrics, right? There are a lot of questions when somebody pick up a MD in pediatrics. It is, there are people who say that this is something that even if you practice just doing MD pediatrics, it's good enough. There's no need to go further. There are many places, many seniors also say that it's okay that you just do MD pediatrics. It's good enough. It can be the end of the end of the road for pediatrics as a branch. Is that true? This is something that I really wanted to know.
So, okay, I'll take you back to 2006 when I entered my post-graduation. Yes, at that point of time, it was considered an end game. So, pediatrics was a coveted branch at that time, along with the other end branches, so to say, like radiology or orthopedics for that matter. And so I joined it in there.
Okay.
Even at that time, subspecialties had not very well started coming.
Okay.
So it used to be considered, it still is kind of an end branch only.
Okay.
But it depends upon where your area of work, where you intend to work after your post-graduation. So I think the most important part of the decision is where do you see yourself maybe 5 years or 6 years down the line once you are joining pediatrics as a stream. I think that makes the crux of what decision you take. Should you take a pediatrics? So it's an end branch. If you want to settle down in your native place, which is not big and not small, there are lots of patients, but not much of pediatricians or subspecialties developed. Their pediatrics is good option to take.
Okay. So how, when you just mentioned that, if you are practicing in a not so big town and now you are practicing in a metro, right, in Gurgaon. So how is it different between the two places to practice?
So, in metros, if I'm talking about private sector work, we are working in a private sector. So in metros, you have big corporate hospitals and you tend to work over there.
Yes.
So, initially to start off, once you go there as a pediatrician who has just passed out his MD pediatrics, or even for that matter done your senior residency of 3 years post MD, you will start off. You would tend to work as you have been working in senior residency and in MD pediatrics with a certain level of skills which you have enhanced working over 3 to 6 years.
Yes.
And you tend to work in that context only. So you do night duties, you day-to-day activities of the hospital you tend to do.
Yes.
And then generally as a fresh pass out or even a 3 years post MD, getting your own OPDs at corporate hospital, I think it is difficult because corporate hospitals, things work on face, and you being a relatively new face, a big corporate hospital which has lot of things at stake will put a well-known face. That's a reality you have to accept. They have the hospitals are spoiled for choices, so they'll pick up what suits them. Having said that, so this is about metro. Now, if you go to your native city, where you come from, so people do know you. If there are not many pediatricians, even if there are, there is still a lot of space for others to work. So there, even if you're MD pediatrics or even if you have done a certain specialized training in fields which are of use in a relatively smaller city setup.
Okay.
Then it becomes easier for you to set up, to start. Okay, so we'll talk about what are those things if you,
Okay.
depending upon the location.
Okay. Okay. Sure. Sure. So when now you have already mentioned that previously when you did your MD, it was an end game, but it's not the same now. So
Yeah, it's not the same now. Now, pediatrics has lots of subspecialties. So the foremost and the one which have been there for quite some time, which was there even when I was doing my post graduation. The one is neonatology. It's not a fellowships now; these are super specialities in their own right. So you have DM neonatology and DMB neonatology, and you
okay.
have 1 or 2 year fellowships in IAP accredited institutes where you can do neonatology. So
Okay.
that neonatology uh, is a thing which works in any city, be it bigger city or a smaller city. You would do the same work. You will do it independently. If you are in a smaller city, you would do in a team under someone in a bigger city.
Okay.
So
Okay.
neonatology is one branch. The second branch is pediatric intensive care. So neonatology is also kind of intensive care for smaller baby, and pediatric intensive care is again the intensive care for
Um,
little grown up children. So again, when you have sick children, you need someone to take care of that. So
yes.
intensive care is is another fellowship or a super specialty program which is available. So
Okay.
mind it that both of these things are a standard 3 years course, like DM neonatology or a DNB neonatology is a 3 years course. Intensive care is also 3 years course.
Okay. Okay.
So,
But
so
you
what,
cannot promote
yeah.
fellowships in any. We should not do fellowships in any of them.
No. See, now the thing is, what again, if you want to confine yourself to neonatology and work in a metro, you have specialty birthing as birth hospital, the maternity and child care,
Yes.
where
Yes.
they cater only to delivered babies. So if you want to work in that kind of a setup, you need neonatology. You
Yes.
do neonatology, and then you can work in such institute, and such things are coming more and more. So
Hmm.
you will get your placement in either of these.
Okay. Okay.
But if you're going to a smaller city where
Hmm.
you have to take care, so then as a pediatrician, you feel you shouldn't confine yourself to neonatology because there are bigger children also. Because
Hmm.
when those neonates become big, the parents will come to you. You cannot say, now I cannot see.
Yes. Yes. Yes.
There so then you have to continue to be a pediatrician. You have to be a neonatologist, and you have to be a pediatric intensive care if the need arises. This thing applies to the smaller cities. So you do a fellowship of 1 year in neonatology at a good center. Now these good centers are again in the metros like Gangaram or all the Apollo hospitals. So you do fellowships of 1 year over there,
Hmm.
learn what it is,
Hmm.
and then you again do fellowship of 6-8 months or 1 year in an intensive care of the same institute or otherwise. Then
Okay.
you come back, you start your setup. So you
Continue.
have to learn the tricks of the trade, and then you have to learn the business also.
Hmm. Hmm. Hmm.
You have to do multitasking. So you have to first figure out, are you cut out for that?
Hmm.
So you have to be an entrepreneur as well as a skilled person. So
I I also feel the biggest challenge of setting up your own practice as a doctor is becoming an entrepreneur, because we as doctors are never trained to become entrepreneurs to understand the business. We are very deep into
yeah,
managing the patients.
no, the doctors have been establishing their clinics,
Yes.
but
Yes.
now with the corporate, if your competitor is corporate,
Then it gets difficult.
then things cannot be managed on ad hoc basis. You have to be at the top of your game. So that is difficult.
That's
And finances, it's a very capital intensive industry. An
hmm.
individual doctor may not be
Hmm.
having that much moolah to start off.
True. True. So, any other branches that you can also talk about?
So apart from neonatology and pediatrics, the one I am working, it's the pediatric cardiology.
Yes.
Pediatric cardiology now as a society grows financially, the children are born who have the infectious disease and the nutritional kind of a disease and sanitation related disease. They slowly, as a society grows financially, these things come down. Then you come to the other diseases which may or may not have relation to sanitation and economics. There comes the role of congenital defects. So people are born with congenital defects, and heart disease are the most common congenital defects. So if India's population is so large, number of babies born are so large, so out of 1,000 babies born, 8 babies will have cardiac diseases. So you can imagine how many children would be born each day, each hour with cardiac disease all over India. So in that context, the opportunities is immense. This is pediatric cardiology. Then there is pediatric gastroenterology. So you have lots of gastrointestinal diseases, malabsorptions and chronic diarrhea, celiac disease, and now more and more so people are going into liver transplant, and liver transplant is a teamwork where the surgeon and the medical team all are involved. So there the role of pediatric gastroenterologist is concerned.
Okay. So how can we, can you please add, how can we also pursue both of these branches, pediatric cardiology, if somebody wants to do,
pediatric cardiology, now there is a DM program in All India Institute of Medical Sciences. It was started, I think, a few years, 3 or 4 years back. Till the time I was doing my fellowship, that program was not there. After that, it has started. So DM program is there in All India Institute of Medicine and Science. There used to be a FNB, that is a Fellowship of National Board, which was a 2 years program which I have done. Now it is converted to a 3-year program. So now it's a DNB. So you have DNB in neonatology, intensive care, cardiology, gastroenterology, and bone marrow transplant and hematology, pediatric bone marrow transplant and hematology. That is also a subspecialty.
So you can do DNB in any of them, and
you can do DNB in all of them. You can do DNB in adult specific these branches. So there is an intensive care. You need to be either an MD medicine or an MD pediatrics. You can do both.
Yes.
But restricting myself to pediatric, these are the subspecialties.
Yes. Sure. I mean, that's very nice to know. So and you have actually mentioned what are the advantages of all of them. So which branch, if somebody who is doing MD in pediatrics right now, which is the branch that you, obviously this is interest based also, but which branch do you think is booming right now, which has good future prospects, with somebody as a student of yours, you will like to, tell that person that you can definitely pick this one?
So if you are a lone wolf who has to make his own destiny, then I think neonatology and intensive care are good things. Because doing some training and then getting associated with all hospitals will take a single consultant. In the tier 2 cities, they'll take someone who has DM neonatology or a DM. They will take one person, and then other senior residents they will pick up. And this can work in a smaller city. In larger cities, again, it is difficult, but you have to spend some time in a bigger institute, and then slowly you can go to a little smaller institute, but it works.
Get a place. Yes.
So neonatology and intensive care are good things.
Good branches to pursue.
Yeah.
Okay.
But so these are good branches if we are talking in terms of ease of getting opportunities. But they are a 24/7 branch. Neonatology is a 24/7 branch. Pediatric intensive care is a 24/7 branch. And because you are a lone wolf, you are the person responsible
for everything.
So this is a trade-off. So you have ease of getting opportunities, but then because you're the only one, you have to be there all the time. So that trade-off you have to manage.
You have to manage. So now when you have already started speaking about the challenges, what are the other challenges that you feel with the field are?
So field vis-a-vis general pediatrician or someone who has done specialized?
General.
I think so for a general pediatrician, So again, so there are technical related to the branch itself, and then the business part of it.
Mm-hmm.
So so there are lots of pediatricians. So you need to have what value do you bring?
Mm.
Because when you pass out pediatrics, there are a lot more people who are already there. Remember, it's an end branch, so it
Yes.
has been an end branch for past 50 years. So
Mm.
there are lots of pediatricians, those who also have done the end branch. So then establishing yourself even in a relatively big city or a relatively smaller city, you will still have many more people. So
Mm.
then creating your own space is difficult, and that's where an additional training and additional exposure of neonatology, pediatric intensive care, where you can bring some value that
Mm.
comes, and then establishing your hospital or this thing. So those are the challenges if you're working in a smaller city. In a bigger city, you will not have challenges of being employed, but you will do run of the mill okay duties every 3 to 4 days, and night day, sometimes evening. So you will not have a routine. So if you want to start your own practice, you will not be able to do justice to both of them
Mm.
completely.
Mm.
So I think those are the challenges.
Mm. Mm. So you get stuck with your practice in hospital only because it gets difficult.
Yeah, yeah.
Okay. Okay. So now if somebody wants to pursue MD in, in pediatrics outside India, what is the scope and how can the person do that?
So, though I did not take that path, but I believe whoever, if you do not have any, restrictions, to move out, many people have everyone has their own conditions. Someone can move out, someone cannot. So, giving an MLE,
Hmm.
going there and getting a training, I think pediatrics is a relatively easier branch to get in US,
Okay.
and then getting trained over there, and then you can choose your subspecialty based upon your interests.
Hmm.
There the business factors and those factors don't come into play, because there all the subspecialties are well established. Whatever you do,
Hmm.
you
Hmm.
can
Hmm.
do good over there.
Yes. Yes.
So
Yes.
so that part is good. It's
Hmm.
a long process, but I think that's a genuine process. Here
Hmm.
MD training is 3 years, there it is much more, then subspecialty is also much more. So your training period is longer,
Hmm.
but I think that works well because you've trained for a longer time, you've gained much more experience, and then you can handle things well. What happens in India, your training period is short, but
Hmm.
even after that 3 years, for next 4 5 years, you are struggling here and there, what to do and what not to do, and still you are not sure where you will land up.
Hmm. Hmm.
So that way, I think overseas it is a good idea.
Hmm. Hmm.
You can even go after completing your MD pediatrics.
Okay.
Then you have to again do your set of training over there.
Okay. So
Again,
we have to
again.
but repeat the MD again over there.
Yeah, yeah, yeah. You have to.
Okay. Okay. But then it is in that case, then it's more smarter to go after MBBS because
Yes, yes, yes. So the smartness is when you, if you're not able to think ahead. That is. So if you think after doing MD pediatrics, you realize that now what to do here. Now should I do senior residency,
Hmm.
or what should I do? Okay, nothing is working out. Let's go. Let me go out. That's one.
Yes, yes.
And the second thing, which we haven't discussed, is working in a government sector in
Ah,
medical colleges. I think that is a time-tested pathway where you can work in medical colleges, MD pediatrics, and 3 year senior residency. Sometimes that also is not required. You are eligible, and you can take up that as a teaching. I think, and that works fine with most of the government hospital.
hmm.
But will you get it? Will you not get it? That also depends from where you are. I'm from Rajasthan. It was difficult for me to get. I did not get, even though I was waitlisted. I did not get. So it depends. If you were in Maharashtra, you do your MD from a particular college or an MBBS from the college, you will get your teaching faculty post very easily. So that depends upon the region where you are hailing from.
Hmm. Hmm. Hmm.
And so that is a time tested, and that's a fair enough. It's a piece of life. You're getting to work, as per your wish, and your quality of work is also reasonably okay as far as it Indian standards.
Yes. And there's no everyday hustle bustle as
Yeah. You always have people working with you, your seniors, your juniors, so there's always help at hand.
yes, yes,
So that's
yes. Hospital setup is help.
yeah. Government hospital in a teaching institute, I think still, if you're sure that you are going to get it, I think that is the best. But financially, the returns are not that much.
That's
So so the peace of mind and financial, I think they are inversely related.
yes, yes, yes. You trade your peace of mind for money.
Yeah,
Yes. So now when you mentioned for, doing MD outside, you mentioned for US. Is there any other country that you can put,
I think all these kind. I think going to UK or Canada, I think they are also
same?
good enough centers.
Okay, okay.
US is a standard example. That's
US
right.
is standard. Yes, yes.
But I think UK is also fine.
Hmm,
In fact, to work in UK, you just need to give a that IELTS.
IELTS.
If you have done your MD pediatrics, let's say, you
Hmm.
just give your IELTS, you go to UK, and then you can work in pediatrics.
Okay.
But then becoming a consultant over there and doing training, then you have to do the whole training
The
once
whole
again.
training course. Yes, yes. That is.
Getting a job opportunity after you've done your MD pediatrics and then just giving an English exam and landing up in UK, you can do a job as long as you want. You will earn reasonably good enough money, a good life, and I think
That's good. Huh?
that's not a difficult path because once you
IELTS is comparatively easier. It's not that.
yeah.
Yes.
That's I think see, we Indians are very hardworking. We can crack any
Yes,
exams.
yes, I completely agree. No, it's a basic English exam. It's not
Yeah,
easy. So you can do that. And if they are not, asking for studies in medicine and allowing you to practice, that's really nice.
yeah,
You're earning well.
yeah.
That's
Because they need hands. They need hands. So if you're a trained pediatrician,
hmm.
so they just know you. They just want okay. You should be able to communicate with their patients. So they
Hmm.
take an English test. Everything else is okay.
Okay with them.
They have their people who will guide you. So quote unquote cheap labor.
Yes, 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 yes. Yes, I can completely agree with this. But yes, there are many doctors who wish to move outside. For them, it is really helpful if
Yeah.
they wish to and if they want to practice. This
And,
is
and there the life is relatively peaceful. If you want to retrain again, then that is also not hectic. So even if you want to train, I think that is a good idea. I mean that decision is an individualized, which we cannot discuss for the whole population.
obviously this decision varies from person to person, but it's just that we're discussing if
Yeah,
somebody wants.
yeah,
That's really insightful to know about everything, all aspects from India to abroad. So
yeah.
if so let's end this on a high note. Anybody who wants to pursue pediatrics, what is something that you want to tell those graduates?
Okay, so it's a good branch. You'll be able to justify your skills very well anywhere in India.
Hmm.
But you should have a vision
Hmm.
and realistic expectation
Hmm.
about where you want to work. See, once you have trained in a better institute and seen all the hi-fi things, coming back to a smaller city and starting all that, it's difficult. So
Hmm.
you have to have that thing that this is what I want to do at the end of 6 years,
Hmm.
and at the end of 6 years, I should be able to cater to this set of population, neonate, intensive care, or this thing. And therefore, I should train in these fields and then go back. I think that roadmap is the most important thing we should have.
Hmm.
If
Hmm.
you have that roadmap, MD Pediatrics is a good branch. If you want to do subspecialty at the end of MD Pediatrics, you have full 3 years to prepare.
Hmm.
1 year, okay, 1 year to find out which is your interest area. Full 2 years to prepare, and you can directly after MD Pediatrics, you do 3 years super specialty. No need to do senior residency and work in that area and move your place up. Initial years would be difficult, but after I think 4 5 years, you will land up reasonably decent. So subspecialty is a good area. Going back to your hometown is a good area. Everywhere you land up reasonably well. The only thing is you have to have vision. If you do not have vision, you will waste your 3-4 years. That is painful.
So the idea is to know your path in advance, be clear what you want to do.
I think that is most important.
Yes. That's really nice, and I believe that's very important for you to keep on track and stay undistracted. Thank you so much, Doctor, for the insightful discussion. I am really, thankful for that. It's insightful for me as well. I'm sure the viewers who are watching who want to pursue pediatrics, it's hell lot of knowledge for them. So I'm sure all of you must have got a lot of knowledge from Dr. Manish. Please share it with your friends and colleagues who are looking of knowledge of this kind. Do share this video, pass on the knowledge. Please help everyone around you. And also stay tuned for the further coming videos on the platform. There are a lot of amazing videos coming up. Please stay tuned and follow us on all these social media networks like Facebook, YouTube, Instagram. We are there on all of them. Thank you so much, Dr. Manish, for this video. We are really thankful for that. Thank you so much. Yep. Bye bye, everyone.